Hi, I'm here today to talk about primary biliary cirrhosis, or PBC as is often called. We're going to begin a journey through the disease. Let's start. So what is PBC? Well, the exact cause is unknown. There is no known cure. It's primarily believed to be an autoimmune disease causing damage and destruction within the bile ducts, leading to fibrosis and cirrhosis. Other theories are that it's genetic, environmental factors such as infectious agents, recurrent UTIs, hormone replacement therapy, cigarettes and the chemicals contained within the smoke, and cosmetics. 90% of the cases diagnosed are women, and the ratio of female versus male is 10 to 1. So what are the body systems afflicted, and how are they afflicted? Neurological, endocrine, respiratory, cardiovascular, renal, fluid and electrolytes, reproductive, gastrointestinal, musculoskeletal, and hematopoietic. Now, if you look at this, we're essentially going head to toe, because as nurses, that's how we are taught to do an assessment. So let's begin. Neurological, hepatic encephalopathy. Exact cause not truly understood, and it can develop rapidly or slowly. Probable causes may be infection, electrolyte imbalance, anemia, GI bleed, dehydration, vascular occlusion, and drugs. Now, the dehydration may occur from like nausea, vomiting, diarrhea, use of diuretics, hemorrhage. Vascular occlusion can happen from a thrombus, most commonly in the portal or hepatic veins, or possibly a tumor from cancer. Drugs would be like benzodiazepines, narcotics, or alcohol. So ammonia. Well, levels of ammonia increase due to the inability of the liver to effectively detoxify. Therefore, it accumulates in the intestine. It's absorbed in the intestine and enters into the brain by crossing the blood-brain barrier, causing inflammation and neurological changes, essentially becoming a neurotoxin. Symptoms are altered sleep patterns, irritability, changes in personality or behavior, decreased attention span, impaired mental or cognitive function, flapping tremors, muscle rigidity, and coma. Lactulose is your primary treatment. It's an osmotic laxative that causes changes in the pH of the intestine or an acidic environment. It causes excretion of the pneumonia through diarrhea. When you give this orally, whether by the mouth or through an NG tube, your dose is 20 grams per 30 milliliters, which is usually one dose. If you give it rectally by an enema, that dose is usually determined by a pharmacist or a physician. Either way that you're going to give it, you give it every hour until 2 to 3 bowel movements, or when patient's mental state increases or improves. Now, rifaximin is an antibiotic, and this is also shown to be effective in treatment against this. It has a less than 1% systemic absorption, and it decreases the chance of resistance. Works in the small intestine. The dosage is 550 milligrams twice a day. However, it's a very expensive drug. Moving on to endocrine. Arginine vasopressin, aka antidiuretic hormone. The major player in regulating water excretion from the kidneys and blood volume. Synthesized in the hypothalamus and stored in the posterior pituitary gland. Early stage of cirrhosis, you have peripheral vasodilation and splenic venous pooling occurring, which leads to decreased systemic vascular resistance, also known as SVR. So when you have a decrease in SVR, this triggers the release of AVP and encourages water retention. So respiratory, ascites. Fluid accumulation within the peritoneal cavity becomes trapped and cannot escape. It's caused by increased pressure in the mesenteric pathways that push the fluid out of the vessels, again where it cannot escape. You may see weight gain, increased abdominal girth, abdominal distension, or dyspnea. This is how it gets to affecting the breathing and the respiratory system by causing the diaphragm to shift or move, causing dyspnea. Now, semi-Fowler's position helps the patient to relieve this dyspnea, or a paracentesis, although not a cure, aids in relieving dyspnea, and it's also considered to be a palliative measure. So, cardiovascular. Hypovolemia leads to excessive strain on the heart, causing a cascade of problems. Decreased perfusion, decreased cardiac output or blood pressure, tachycardia, ischemia, cardiac arrhythmias, myocardial infarction, possibly even death. Reproductive menopause is the permanent cessation of menstrual cycles following the loss of ovarian follicular activity. Hormone replacement therapy, or HRT, assists in providing relief from symptoms of menopause. And these symptoms can be decreased vascularization in the vagina or surrounding tissues, reduced genital perfusion or engorgement. Hepatotoxicity is an adverse effect from synthetic hormones. It may cause cholestasis. Gastrointestinal. Scar tissue and impaired bile flow impede the body's ability to break down or digest fatty foods. Therefore, fat is excreted in the stool, or commonly known as steatorrhea. Varices often develop due to the effects of portal hypertension, which we'll talk a little bit more about in the hematopoietic system. But esophageal varices may not have any symptoms until a leak or rupture occur. You may have rectal varices in the form of internal hemorrhoids. Painful defecation may lead to constipation. You may see blood within the stool itself, within the toilet, or on the toilet tissue. And thrombocytopenia further complicates recovery from a leak or rupture. Musculoskeletal. Fatigue is the most common symptom of cirrhosis, by far. Up to 75% of your patients will have this symptom. It may lead to decreased muscle tone or muscle wasting by lack of physical activity. Muscle depletion may also be caused by malabsorption of protein, vitamin D, calcium, and we might also add in there vitamin A, okay, because of malabsorption. But this disease can cause a decrease in appetite. Therefore, patients may not have an adequate dietary intake, may need to have nutritional counseling to help with that. Hematopoietic. Well, blood is comprised of the three main components: blood cells, platelets, plasma. Liver is the largest blood reservoir in the body. Homeostasis problems involves clotting factors, fibrinolytic products, and platelets. Thrombocytopenia. This occurs when the platelet count falls below 100,000 platelets per millimeter of blood. Clotting factors such as factor VII, this is the first to decline, then progresses to prothrombin, decreasing, and then to factor X. Disseminated intravascular coagulation, or DIC, is multiple defects happening that causes clots to form within the general vascular system that consumes and depletes the necessary components needed for continued clotting and will lead to uncontrollable hemorrhage and possibly death. Albumin is the main plasma protein produced only within the liver. It makes up 80% of intravascular colloid osmotic pressure. When you have decreased levels, this can lead to escape of plasma from general vascular system into the surrounding tissues, producing hypovolemia and hypotension. Portal hypertension, here we go. A backup of blood flow through the liver circulation that results in increased pressure in the esophageal, gastric, portal, and mesenteric veins. The most common cause is obstruction because of the cirrhosis, that fibrosis. Collateral circulation can develop, causing blood to bypass these obstructions. So varices can develop in the esophagus, the stomach, and the rectum. You may have splenomegaly, enlargement of the spleen. This can occur due to the increased pressure within the splenic vein. You might also have ascites, again, accumulation of fluid within the peritoneal cavity, occurring due to the pressure of being forced out of the vessels, the fluid, and into the peritoneal cavity. So, conclusion. We've really gone fast here, so let's just take a little bit of time to go over our conclusion. There is no known cure. Now, you might ask about liver transplantation. Yes, liver transplantation, in a way, is a cure. However, it's not open to everybody, and not everybody signs up to become a donor, so the livers that are available are far and few between. Primarily thought to be an autoimmune disease, genetic or environmental factors can play into it. Women are the gender that's most affected. Remember, 90% of the cases, and the female to male ratio is 10-1. Symptoms are vague. They mimic other diseases, okay? So it's not easy to say, yep, you have PBC. You may find things from routine blood tests, not even knowing that you have this disease. Fatigue is the most common symptom. Now, women, being the gender most affected, downplay their symptoms. It affects many systems. We know that. We just talked about how they're affected. It's like a domino effect. When you line up your dominoes and you hit that very first one, all the ones behind fall. And we talk about that head to toe. The patient needs to adhere. Adhere is capitalized because of the fact that patients need to take responsibility for their quality of life. They need to adhere to diet changes, medications, and exercise regime. We know that there's pros and cons to the treatment, okay? Some of those, again, diet modification, medications being expensive, the cost, exercise, I'm too fatigued, I can't do it. As science continues to advance daily, we hope that somewhere down the line and in the near future, a cure may be found for PBC. The body is an amazing organ and it tries to heal itself, but science needs to give it that extra push. And let's hope that we can find a resolution to this disease that affects so many women. So if we look at this concept map, again, this is kind of a conclusion. You have primary biliary cirrhosis. We know there's no known cure. You have modifiable factors such as diet, exercise, activity, medications, and adherence. That can all lead to increased quality of life. Now you have non-modifiable factors in which we talk about age, race, genetics, family history, non-compliance. You can't change those. And then again, the body systems and how each one is affected. Thank you for taking the opportunity to view this. I hope that you have learned about primary biliary cirrhosis. Thank you. The references are as follows.